Okay, we are here live in Fort Myers, Florida, and we have a great patient here. But you had an interesting history. You had myopic implants put in. How long ago was that?
That was about, oh my gosh, 8, 9 years ago.
Yeah. So they were special lenses that I don't think they're too popular nowadays, but they would be put inside the eye to correct myopia. I don't know what degree of myopia were you? Do you recall?
I'm very, very nearsighted, and
Do you remember the minus number, diopters?
no, I don't.
Okay.
But it would be like reaching, here's my glasses. Where are my glasses?
Okay,
Right
so
here.
you were probably -6 or minus to 10, whatever.
I couldn't see them if they were on the bedside table.
Oh, that's extremely myopic. Okay.
I would have to look,
Okay.
maybe I could see an orange lump there or something, but...
Anyway, there was a point where you had to have those removed because you were developing cataract. You had cataract surgery done bilaterally by one of our local doctors who did a nice job technically on the surgery, but you had those Technics implants that you found less than adequate, correct?
Yes,
Yeah,
there's
okay.
too much glare with that.
Yeah, that happens. But what about your floater situation? Did you develop that right after the implants were put in, or was that something before?
No, that happened, I've always had a little bit of floaters.
Yeah, of course. But I mean the ones that
The
you can't
huge
see.
blobs developed
Yeah.
just in this past February, which was a couple years after,
Okay.
a year or two, about 2 years after.
Yeah, and what I saw was you had these large masses of, looks like a ball of dust or fibers. We call them a jellyfish, a fibrillar mass, and they were moving in your visual axis. And when they were in the visual axis, what was your perception of the world? Could you see okay, or what?
No, it was very, very obnoxious. I was having trouble reading. If I went to look at my words, I couldn't see them because the blobs were in the way. And sometimes it was so bad that, sometimes I'd close my eyes to calm them down. But sometimes they would I'd give up and say, well, I'm not reading today.
Okay, so that's I think that's a fairly big opacity. Most floaters are not like that, and I think that's one of the reasons that doctors don't quite understand what a patient has to put up with. And I might mention that you're a very good surgeon from Bonita Springs here. He got you 20/20 in the right eye, uncorrected. And what is the left eye, 20/25? So that's considered a top result, although
Right.
you're still bothered by the actual secondary effects of that Technics implant, which in some patients causes nighttime glare and other problems.
And I took this problem to him about the blobs.
Oh, what did he say about the blobs?
And he said, well, just give it time, they'll go away. I've got floaters too. And I said, you don't have floaters like this, or you would not be doing what you're doing. You would not be a surgeon if you had this. So that's when I started hitting the internet.
Right, and you found out I was just down the street.
Yeah.
You never heard my name before. I've been doing this for 30 years.
No, I looked up, help me, I have floaters.
Oh, you're kidding. And it came up well.
And
yeah.
you popped up,
well,
and I went, wow, I'm checking that out.
You just happen to be very lucky because there's nobody anywhere, and I can say this with absolute certainty, that has more experience in this than me. I like doing this. This is fun for me. It makes me come to work every day and be with my happy, lovely staff. But
when it said, well, there's 3 people in the country that do this, and one is an hour away. I'm like, yeah, okay.
And of course, your doctor never mentioned my name, but he knows how to do this. Well, maybe someday if he'll see enough patients, he'll say, well, maybe this is okay. I still find it astounding that they throw off patients and the patients are left in the dark. And across the board, most floater patients don't have the kind of problem you have, and that's the kind of patient that I see. And we love to help them. And you're a great patient, and I enjoy sitting here talking to you so I don't have to see other patients go.
Thank you.
Okay, thank you.